Which factor is most important in managing the risk of organ injury during CPB? A. Blood pressure regulation. B. Oxygen delivery and perfusion. C. Maintaining normal body temperature. D. Use of anticoagulants. Answer: B. Oxygen delivery and perfusion. Explanation: adequate oxygen delivery and tissue perfusion are crucial for preventing organ injury during CPB. Hypoxia or poor perfusion can lead to ischemic damage, especially to sensitive organs like the brain, heart, and kidneys. Maintaining proper blood flow and oxygenation is essential for reducing the risk of injury during the bypass procedure. What is the primary cause of the increased risk of bleeding associated with cardiopulmonary bypass? A. Platelet aggregation. B. Heparin-induced thrombocytopenia. C. Altered coagulation pathway. D. Thromboembolic events. Answer: C. Altered coagulation pathway. Explanation: CPB affects the coagulation system by altering platelets and clotting factors, leading to a tendency for both bleeding and thrombosis. The use of heparin to prevent clotting during the procedure and the subsequent reversal with protamine can contribute to coagulopathy. Managing coagulation during CPB is essential to minimize bleeding complications. Which of the following metabolic disturbances can result from inadequate glucose management during cardiopulmonary bypass? A. Hyperglycemia and delayed wound healing. B. Hypoglycemia and neurological dysfunction. C. Hyperkalemia and arrhythmias. D. Hypercalcemia and kidney dysfunction. Answer: B. Hypoglycemia and neurological dysfunction. Explanation: inadequate glucose management during CPB can lead to hypoglycemia, especially if insulin therapy is not well controlled. Hypoglycemia during CPB can cause neurological dysfunction, including confusion, seizures, or even brain injury. It's important to monitor glucose levels and administer insulin or glucose as necessary to prevent this complication. Which of the following interventions is commonly employed to prevent metabolic derangements, such as acidosis, during cardiopulmonary bypass? A. Use of high-dose steroids. B. Administration of sodium bicarbonate. C. Restriction of oxygenation. D. Enhanced ventilation with higher tidal volumes. Answer: B. Administration of sodium bicarbonate. Explanation: sodium bicarbonate is frequently administered during CPB to correct metabolic acidosis caused by anaerobic metabolism and lactate accumulation. By buffering excess hydrogen ions, bicarbonate helps normalize the blood pH and prevent acidosis-related complications such as arrhythmias and impaired organ function. In patients undergoing cardiopulmonary bypass, the use of a blood oxygenator can result in A. Increased metabolism of glucose. B. Reduced oxygen delivery to tissues. C. Altered carbon dioxide removal. D. Improved blood gas exchange efficiency. Answer: D. Improved blood gas exchange efficiency. Explanation: the blood oxygenator used during CPB is designed to enhance blood gas exchange by providing oxygen to the blood and removing carbon dioxide. It mimics the function of the lungs, which helps maintain adequate oxygenation and remove metabolic waste products, such as carbon dioxide, during the procedure. Which of the following is an important consideration in the management of metabolic acidosis during cardiopulmonary bypass? A. Maintaining normal electrolyte levels. B. Maintaining mild hypothermia. C. Adjusting ventilation rates to control CO2 levels. D. All of the above. Answer: D. All of the above. Explanation: managing metabolic acidosis during CPB involves maintaining normal electrolyte levels, such as sodium, potassium, and calcium, controlling ventilation to regulate CO2 levels, and ensuring mild hypothermia to reduce metabolic demand. All of these factors contribute to preventing or correcting acidosis and maintaining stable pH levels during the procedure. What is the effect of CPB on insulin sensitivity and glucose metabolism? A. Increased insulin sensitivity and decreased glucose production. B. Decreased insulin sensitivity and increased glucose production. C. No effect on insulin sensitivity. D. Enhanced insulin secretion and glucose uptake. Answer: B. Decreased insulin sensitivity and increased glucose production. Explanation. During CPB, there is often a decrease in insulin sensitivity and an increase in glucose production due to the stress response and altered metabolic pathways. This leads to hyperglycemia, which needs to be managed with insulin therapy to avoid complications such as infection and delayed wound healing. Which of the following metabolic interventions is most effective for preventing ischemic damage during cardiopulmonary bypass? A. Maintaining low blood pressure. B. Administering diuretics. C. Maintaining normothermia. D. Ensuring adequate oxygen delivery and perfusion. Answer. D. Ensuring adequate oxygen delivery and perfusion. Explanation. Ensuring adequate oxygen delivery and perfusion is the most effective way to prevent ischemic damage during CPB. Hypoperfusion or hypoxia can lead to irreversible damage to organs, particularly the brain and heart. Maintaining proper blood flow and oxygenation is key to minimizing the risk of ischemia and tissue injury. What role does potassium management play in metabolic control during cardiopulmonary bypass? A. Potassium is monitored to prevent hyperkalemia, which can cause arrhythmias. B. Potassium is regulated to improve glucose metabolism. C. Potassium is altered to enhance oxygen delivery. D. Potassium has no significant role in metabolic control during CPB. Answer. A. Potassium is monitored to prevent hyperkalemia, which can cause arrhythmias. Explanation. During CPB, the potassium levels in the blood must be carefully managed. Both hyperkalemia, which can lead to life-threatening arrhythmias, and hypokalemia, which can cause muscle weakness and affect cardiac function, need to be avoided. Potassium levels are monitored and adjusted to ensure proper cardiac and neuromuscular function during surgery. What is a common method to mitigate the metabolic effects of CPB on the brain? A. Hyperventilation to reduce carbon dioxide levels. B. Use of deep hypothermia. C. Administration of sedatives. D. Monitoring and optimizing cerebral oxygenation. Answer. D. Monitoring and optimizing cerebral oxygenation. Explanation. The brain is highly sensitive to changes in oxygen delivery. Monitoring and optimizing cerebral oxygenation during CPB is crucial for preventing neurological damage. This can be achieved through proper blood flow, oxygenation, and the use of techniques such as near-infrared spectroscopy, NIRS, to monitor cerebral oxygenation in real time.